to a real tight schedule, but I really honestly want to thank you for your working terms and getting us medicines and equipment and every stuff that you can think of. This year has been a great time for us. Our child mortality rate has been the lowest in 20 years of working in the slums. It's about 29.7 under the age of 5 for every 1,000 live births. We've been working in the slums of Delhi for the last 20 years, and today morning you are going to go across to Ambedkar Basti, and that's the first clinic that we started in 1988. And I feel the pediatrics now is basically a school teacher doing mass genetics, and she started the work. We would get samples and inform Mr. Mandisi, the Commissioner of Slum, and say, what are you doing? You don't have a good opportunity. Why should they go to only the government hospital? They can come to us, give them the best of treatment, good equipment. Medical doctors come there at some places twice a week. We have community health volunteers who we have trained, and they are the medical doctors. They are responsible for about 200 families. They catch what's the problem in the slums, and after intensive training, they bring the patients to us. And if we can, in the slums, treat them in our clinics, then we have this polyclinic facility here where they have to treat the best. The last year has been a tremendous, new focus that's taken place here. We had so many volunteers starting from students from the UK and even up to Harvard students coming. This year we had about 6 students from Harvard who are volunteering with us, of course, to train the animation of the $6 billion industry today, 10 years from now. And if they complete the school, they are rest assured of a job in the market. And those boys are studying it from 6 to 7:30, but in the daytime they are working with us. They were boys and girls from our child healthcare program, and then they came to adolescent group, and then they became members of the parliamental, and they finished their schooling. What to do? Do a course. And we really are grateful that we are in a position.
Martin, that was very enlightening, and not only enlightening, very moving. I now request Mrs. Mrinal Jingani, who is there from New York, just speak about the nutrition values and nutrition upgrades.
Towards very high numbers of diabetics and heart disease patients, and it's across all strata. So we launched a site called Nutrition Wisdom, which addresses the need for preventive, and this is what I see through these buses and all, where people really can't afford a decent square meal in a day. Here we're talking about fancy foods and eating antioxidants and having a glass of red wine in the night. And there you've got people who can barely eat, dal roti. So how do you address nutrition for them? And really the simple answer is to teach them, to create an.
I think after listening to Mr. Martin, we have got nothing much to say. We have heard a lot about kind of activities they are involved into, the kind of activities they are doing, kind of activities they are performing. It is mind-boggling, and it is really indeed a privilege for our Rotary Club, that we are able to contribute a little bit. But my suggestion to Mr. Martin and to Rakesh for this year, if we can really create another roadmap where a lot of our members who want to get involved, besides giving some donation or a charity by in shape of a refrigerator or something, where we can come, where we can also participate physically, we can go to the slums, we can do, and as a Rotary we can do something more, because our vision as per the international president is, this year the theme area is hygiene, waterborne diseases in the child, and the slogan of this year is make dreams real, for the unprivileged children who cannot survive, and because can you believe 30,000 children die every day due to these diseases. So thank you very much for being over here. Thank you.
To take this opportunity today on behalf of ASHA to extend my heartfelt thankfulness for each and everyone who come here today, for donating whatever Mr. Martin told you, all the fridge, the medicines, which will be of great help to all the slum dwellers and all the clinics that we are working in. And I thank you, Dr. Mrinal, for your thought-provoking small talk that you did. I thank the President of Rotary Club. I thank you, Mr. Dinga, especially because he's been coordinating and keeping in touch with me organizing all this. And thank you so much. And I invite everyone for a small inauguration downstairs, which will be followed by a walk in the slum, with the nearby lassi that we have. And I would invite all of you to come with us and take a look of the work in action. Thank you.
Second group, yeah.
We are always there. We are there sometimes.
Take money.
Well, we have worked in healthcare.
Isn't this government?
That's what we are supposed to be. At the end of the talk, she said, "Why did you get me this forward to you, not to me?"